of the Superior Physical Therapy's YouTube page. I'm here today. My name is Andrew Grecki. I have a doctorate in physical therapy and I'm also the owner of Superior Physical Therapy. I'm here today to talk to you about lumbar stenosis. I get a lot of patients that ask me about lumbar stenosis, and they seem to have the impression that if I have an x-ray that shows that my lumbar spine has stenosis, that I have to just live with the pain. And I'm here to tell you today that's absolutely not true. Stenosis is the Latin word for narrowing. So we know that there is, on each side of the lumbar spine, as you can see here, you have these little nerve roots, okay? These nerve roots come from each level of the spine and travel down the lower extremity. So somebody might have symptoms of back pain, but they also might have symptoms of pain that radiates down their leg, as well as numbness or tingling. In fact, we know that there are research predictors that would indicate that if you have these three things, you are 97% likely to have stenosis. Number one, over the age of 55 years old. Number two, I have back pain with walking. And number three, my back pain subsides or goes away when I sit down. If you have those three symptoms, most likely you have lumbar stenosis. So let's talk about what stenosis is. We just said that it's narrowing. So where this nerve comes out, there is a hole. And that hole is made up of two segments that sit on top of each other. And that hole is dynamic. So the hole is a dynamic hole that can open and close with movement. So we know that there's specifically three movements that can cause the hole to get smaller. We know that when I extend my spine backwards, the hole gets smaller. On my left side, I know that if I side bend to the left, that hole gets smaller. And if my left side, again, is the focus, when I rotate to the right, that hole gets smaller. That's oftentimes why somebody who's a golfer has back pain because of stenosis, because they rotate, they side bend, and they extend. If you're the left side lower back, that hole becomes very, very small and can be very, very painful. So the same can be said about ways to treat lumbar stenosis. The exact opposite motions are going to open the hole up, which if you're the nerve coming out of that hole, you're going to be very happy. So the three ways to make that hole bigger, if you're the left side, the number one way is to bend forward. The number two way is to side bend away from that side. And the number three way is to rotate to the left. So any exercise that has those three movements are going to make the hole bigger. Therefore, somebody with lumbar stenosis can eliminate their pain through movements. In part two, I'll be showing you what movements I would do to make that hole bigger. Thank you.